Good evening. My name is Joanna Rodriguez, and today I'm presenting a grant proposal that addresses colorectal cancer among rural Hispanic communities in Nebraska. This project combines bilingual mailed fit kits, mobile health outreach, and patient navigation to reduce disparities and save lives. I am requesting 500,000 in funding. Colorectal cancer, or CRC, is the second leading cause of cancer-related deaths in the United States, yet it is highly preventable with early detection. Rural Hispanic communities in Nebraska face higher risks due to barriers like language discordance, lack of transportation, and limited access to care. These barriers often result in delayed diagnosis, higher costs, and worse outcomes. My proposal is to implement a bilingual mobile screening program that improves access and increases screening adherence. Today, I will outline the extent of the problem, current efforts, and how this project offers a unique and effective solution. CRC is the fourth most common cancer in the United States and the second leading cause of cancer death. Each year, nearly 153,000 new cases are diagnosed, and over 52,000 people die from the disease. American Cancer Society 2023. Nebraska mirrors these national trends with Hispanic residents disproportionately affected by late stage diagnosis and lower screening adherence. Zand et al. 2021. Early onset CRC defined in as cases diagnosed before age 50 is increasing at alarming rates among Hispanic populations, emphasizing the need for earlier and more targeted prevention strategies. Garcia et al. 2018. Late diagnoses are also placed an enormous economic burden on families and healthcare systems. Treating advanced stage CRC costs significantly more than preventing or detecting it early. This proposal aims to reduce these disparities while also lowering long-term healthcare costs. Colorectal cancer develops from adenomatous polyps, which can become malignant over time due to genetic and epigenetic changes. Risk factors include poor diet, obesity, physical inactivity, smoking, alcohol use, and hereditary conditions such as Lynch syndrome, ACS 2025. In early stages, CRC is often asymptomatic, which is why regular screening is so critical. When symptoms do appear, they may include rectal bleeding, iron deficiency anemia, abdominal pain, and changes in bowel habits. National Cancer Institute 2024. By the time symptoms develop, the disease is often advanced, making treatment more difficult and outcomes poorer. Several screening options exist. Colonoscopy is considered the gold standard, but it is invasive, costly, and often inaccessible in rural areas. The fecal and hemoc test or FIT kit is more accessible and can be mailed directly to patients. FIT has a sensitivity of approximately 74 and specificity of 94%, making it more both reliable and valid population level screening. Cava et al. 2025. However, the success of FIT depends on the consistent use and timely diagnostic follow-up after abnormal results. Without navigation and support, adherence and rates fall. This highlights the importance of combining reliable screening tools with culturally appropriate outreach to maximize effectiveness. Host and environmental factors play a role in colorectal cancer disparities. Risk increases with age, is higher in men, and is influenced by genetics. But among rural Hispanics, social determinants of health create disappropriate risk. Many residents lack health insurance or have jobs in agriculture and meatpacking with long hours and no paid time off. These jobs make it difficult to schedule preventative screenings. Language barriers limit communication between patients and providers, while cultural beliefs and medical mistrust reduce trust in the healthcare system. Ratnapradipa et al. 2023. Geographic isolation adds another layer of difficulty as many rural areas lack gastroenterologists or nearby clinics. Taken together, these factors create a cycle where rural Hispanic Nebraskans are less likely to receive timely screening and more likely to face late-stage diagnosis. Addressing these barriers is essential for reducing disparities. Nationally, colorectal cancer incidence has declined among older adults, largely due to increased screening uptake. However, incidence has increased among younger adults, particularly in Hispanic populations. Zand et al. 2021. The COVID-19 pandemic further delayed screenings, causing significant backlogs. Rural areas, including Nebraska, have been slower to recover compared to urban regions. This has likely contributed to later stage diagnosis. These trends highlight the importance of developing adaptable, resilient, and community driven screening strategies that can withstand disruptions and reach underserved populations. Several programs already aim to reduce colorectal cancer burden. The U.S. Preventive Service Task Force recommends routine screening starting at age 45. USPSTF 2021, Nebraska operates a colon cancer screening program for uninsured residents, and the CDC's colorectal cancer control program funds state level outreach. Mobile health units and bilingual navigation have been tested in some areas with promising results. Miller et al. 2021. However, these programs have been consistently implemented in rural Nebraska, and many Hispanic residents still lack access to culturally appropriate screening support. Gaps in knowledge and practice remain, leaving these communities vulnerable. Despite national programs, research specifically addressing rural Hispanic communities is limited. Few studies explore how language barriers and acculturation affect colorectal cancer screening in Nebraska. Garcia et al. 2018, Ratanapradipa et al. 2023. Data on follow-up completion after abnormal fit results in inadequate, leaving questions about the effectiveness of current interventions. Nebraska also needs better surveillance systems that capture race, ethnicity, and language data. Without this information, it is difficult to design effective programs. Addressing these gaps require innovative approaches that combine epidemiological evidence with culturally tailored outreach. My proposed solution is a bilingual mobile fit navigation program. Fit kits would be mailed directly to the household in rural Hispanic communities with bilingual instructions tailored to lower health literacy. Mobile units would travel to rural towns to collect kits and provide follow-up colonoscopies for abnormal results. Bilingual navigators, often from community itself, would contact participants, provide education, and assist with referrals. Transportation support would ensure that abnormal results are not ignored. Partnerships with local clinics, schools, and faith based organizations would strengthen outreach and build trust. This program leverages the cost, effectiveness, and accessibility of FIT while addressing language of transportation and cultural barriers. It is evidence based and culturally responsive and uniquely designed for rural Nebraska. This program deserves funding because it addresses a clear need with a practical evidence-based solution. Mail fit programs combined with navigation have proven successful in rural areas. Keva et al. 2025. By adding bilingual education and transportation assistance, this program directly targets the barriers faced by Hispanic communities. Preventing late-stage cancer reduces costs and saves lives, making this approach both compassionate and economically wise. The program is also scalable. If successful in Nebraska, it could serve as a model for rural minority populations across the country. Your funding will help us close disparities and create long-lasting change. The requested 500,000 will fund Fit Kits mailing and collection, bilingual navigator salaries, mobile unit operations, and educational campaigns in both English and Spanish. Transportation support will ensure that patients complete diagnostic testing after abnormal results. We expect at least 20% increase in screening rates among rural Hispanic adults in the targeted counties. Beyond numbers, this program will build trust, empower communities, and create a foundation for long term cancer prevention and health equity. In conclusion, colorectal cancer is a deadly yet preventable disease that disproportionately impacts rural Hispanic communities in Nebraska. Current programs are not meeting their needs, leaving gaps that result in preventable deaths. My proposed bilingual mobile fit kit navigation program addresses these barriers directly, combining evidence based screening with culturally appropriate outreach. With $500,000 in funding, we can increase screening rates, detect cancer earlier, and save lives. I thank you for your time and consideration and hope you will join us in reducing disparities and advancing health equity in Nebraska. Board members, I want to leave you with this. Rural, rural Hispanic communities of Nebraska face disappropriate barriers to colorectal cancer screening. With your $500,000 investment, we can implement a culturally tailored and mobile outreach and navigation program that will save lives, reduce disparities, and build a healthier future for underserved families. This is not only an investment in healthcare, but in equity and justice. Here are the references that inform this proposal, including national guidelines, American Cancer Society reports, and peer-reviewed studies examining disparities and interventions in colorectal cancer screenings. Thank you.